So welcome everyone to the new BHSD Timeliness training for CCP staff. My name is Chris Lee. I work for the A&R division, the AHR team. Who I have with me is will be assisting is Stephanie Tran, who is also part of the AHR team. We have also Veronica Marquez and Sandy Mendoza from the QI team to help answer your questions. So what I want to start with is things to know. So introduction. So the BHSD tool form is a recently implemented implemented instrument designed for monitoring client referrals and submitting client services information to the state, which is CSI. Things to know: there should be only one BHSD timeliness tool per episode. The timeliness tool replaces the referral disposition and the CSI assessments. The timeliness tool can be edited, which I will show in the training. The timeliness tool is required data that we submit to the state. The tool was also built with event logic. Depending on what you select, one field could become activated or deactivated, which I will also show in this training. If you select something by accident and you want to deselect, you can hit F5, which I will show in this training. All yes, no fields are required. If not applicable, select no. If the referred client does not show up for the intake, which results in not admitting the client to the program, then the team will need to complete the timeliness tool under the pre-admit program. This is the same that exists, but instead the CSI assessment is the timeliness tool. What else I want to share, which has been emailed out, is that how this will be set up is that we know we have the PCE CCPs, and then we have PCNX manual billers 837s who already enter CSI assessment directly into my avatar, PCNX. So for PCE users, the email has been sent out to see who we should give access to. So there has emails gone out. So please respond to the email for any CCPs that have PCE CCPs that have not responded, so we know who we need to give this form access to in my avatar. For any CCPs that are already have access to my avatar and are entering CSI assessment in my avatar PCNX, what will happen is that the CSI assessment, you will not be able to search for that form. Instead, you would just have to complete the BHSD timeliness tool. So all this change will be beginning June 1st of this year. So that's when the switch happens. So with that, are there any questions? Okay. What I will show next is briefly for individuals that might not know, is that this guide will also show you individuals that haven't logged in my avatar how to go about it. So you'll see the next step was you will have a link. You'll receive a link to PCNX. It'll look something like this. You'll enter your system code, then your username, password. After you log in, there is this search bar on top. You'll search for the tool. You can also then search for the client. Then you search for the program that you're in, and you're in the farm. Now I'm going to switch over to my avatar NX now. So this is what it looks like once you're logged in. What you'll see is I already have my test client selected on the left. So what I need to do is now go to the form. So to go to form, BHSD Timeliness tool, you select the tool. For you all, you will only see your program. Because of my access, I see all programs, but for example, if I was Aki, I will only see Aki. So for this example, I'll click Aki as a program. And this is the form. I'll make it a little bigger for everyone. Okay, so we'll kind of go step by step of how to complete the form. So data first contact to request services. So what to fill in this is the when, for example, if a family member walks into a center to request services, that is the first day. So if that happened on the 1st of April, then that's the date of first contact to request services. It will tell you once you put a date in there is that a successful referral for non-psychiatry is the client has been rendered a first follow-up service. You click OK. And keep moving on. Next question asked is for referral source. You click on the down box and it has a number of options. For the example that I'm going to do, as I said, is a family member that walked into a center. So the referral source is family member. The point, something else to know about this is if other referred is selected, meaning that none of the other options seems to fit what the referral source was, you can click other referred, then it becomes required to specify if other referred, what it is. And you'll notice that that is part of these event logic that's in the form. Everything in red is required. So other fields can become red required depending on what you select. So back to my example, I'm gonna go back to family member. You see that box grays back out. Then you want to know the points of access. So where did they go in? Where was this? As I said, it was a walk-in. So I would select walk-in. If it was from the call center, the course, the FCS, and so forth, you'll select the one that best fits. If once again, you should select the other referred source, okay, the specified other, you'll see that is not required for this field, which means that if you have the information, please complete. If you don't have it, then it's fine. For my example, again, it's walk-in. Grays back out. And you scroll down, you'll see that there is an IST number. If you click on the IST number, you select the one that best fits, if it is applicable. So for my purposes, since I know that it was for Aki, program referral was Aki, there was IST completed on the 1st of 2024, then I can select that. So the first service appointment offer date. So how soon was I able to offer a first service? So I'll say that it was on the 5th. And because we live in a perfect world, they also was rendered on the same date, meaning that we offered this appointment on the 5th, I offered it on the 5th, and I was actually have the appointment rendered on that same date because they were free that day. Something I want to slow back down a little bit is that because I select IST number, you'll see that the day of first contact request services did become grayed out. The reason Reason for that is because the referral date is on here. So you're using this date as your first contact to request services. For my example, I'll say that there was no ISD, just so that I can work with my example. So I'm going to change this back. Reason I want to keep that is that I want to explain then, was access to service delayed? Was access to service delayed was the data first contact to request services greater than 10 business days than the first service appointment offer date? So 10 business days does not include weekends or holidays. So we will not count weekends or holidays. So I can tell just looking at it, this is not greater than 10 days. So was access to service delayed? No. Now, if it was a first, or what if what if we were using IST date for ACI? So now we see that that was the first. That's when the first contact to request services occurred. And the first appointment offer date I could give was on the 5th. So was access to service delayed? Yes. And from here, you'll see that there is then, this becomes a required field, reasons for delayed access, and choose the one that best fits. Is it beneficiary choice treatment modality unavailable? Or was it preferred behavioral health provider unavailable? Preferred service medium unavailable? Also gives examples. No available provider, or other. If other is selected, specify the other. For my example, I am going to say that this did not happen. So I want to also show I made a mistake saying that this was actually, and I want to unclick. So one option is that F5 key. So if I click on other and I click F5, you see that the radio button is now unselected. So I'm gonna go back, click no, just for my example. I'm gonna X this out. There's an X behind this MH right here, and put back my date. Okay. Okay. At this point, I want to stop right here. Are there any questions? Once again, you can ask in the chat, or you could also raise your hand and we can unmute so you can ask your question.
Andrew has a question.
Of course.
Can you hear me?
We can hear you, Andrew.
Okay, so the question for me is, so we've been getting a list, we've been retrieving a list of referrals from, what is it, SharePoint or whatever, I forget where I get it. With this new system, is there going to be a list that's going to be generated that I'm be working from, or am I going to have to figure out which referrals came through us, through our internal system? Let me ask this a little bit. The county would say, I would have a list of referrals that the county expected we had gotten.
Mhm.
How am I going to know which ones are you expecting to have data for on a monthly basis is what I'm getting at.
So let me make sure, Andrew, and which CCP do you work for?
Bill Wilson Center.
Bill Wilson, okay. So I want to make sure I understand. So the referral process is the same. The referral process is not changing, right? That's understood?
Right.
Okay. So the only thing that's changing is instead of a CSI assessment being completed, you're just replacing it with the BHSD Timeliness tool.
Right, but on a monthly basis, there was a spreadsheet that had to be filled out, which this is replacing. this process is replacing,
Okay,
right?
yes, there is a spreadsheet, yes.
So that spreadsheet would have a list of referrals that I would then go and have to get the information and update and upload to the county for the county. Is there going to be a list still, or am I going to have to? I might have to create a system so that I know internally where our referrals are coming from, or what referrals need to be updated.
Yeah, Veronica, do you have an answer for this?
Yes. Hi, Andrew. So
Hi.
yeah, everybody's been receiving the expected referrals that we have identified through the ISTs that have been sent out to all of you. And with the changeover from the spreadsheet to this tool, you will no longer receive that list. So the expectation would be that you create your own way of tracking the referrals that you are receiving. However, I'll give a caveat that I'm trying to see right now. I'm trying to put in a request right now to see if they can build out a referral report that you would be able to run for your agency or clinic that will list this out. I don't know if that's going to be feasible, but I'm hoping it can be. But in the meantime, you would have to do your own system for tracking the referrals that you have coming in. And then Andrew, are you on SUTS or mental health or both?
Mental health.
Okay, I believe there is actually another list that gets sent out to mental health providers currently that's being also posted on SharePoint that is just a referral. I don't know who has access to it for each clinic, but I would ask around because it's also on SharePoint, and I want to say it's the same folder that you were receiving the tool at for the timeliness tracking. And I don't know if there's a plan to stop that or continue at the same time, but that also might be an additional resource for mental health clinics.
Wait, thank you, Andrew.
Elsa has a question.
Hi, I'm just curious, is this for providers also? Or because at Gardner, we enter the referral information and some of this stuff is not a referral. And I heard you guys were gonna do a spreadsheet, so you're gonna send us some kind of spreadsheet with this information, or how's that?
Veronica?
Yeah, sorry, I was waiting for you. I didn't know if you were going to
Yeah,
answer.
yeah, no worries, no worries.
So no, we've been sending out the timeliness tracking through a spreadsheet on a monthly basis already, and we've been sending out some of the information that you already received through the referral on the IST, which is the integrated screening tool, and we were pre-populating it into a spreadsheet to make it easier for everyone. And then all this information that is on the screen on this new tool was being captured on this spreadsheet. Basically, we're just switching the process from a Excel spreadsheet to directly into my avatar. Through whatever avenue there, if it's a PCNX form or for county, it's directly into my avatar. So no, we're not providing a new spreadsheet. We're actually moving away from the spreadsheet.
Okay, I will keep us moving. There will be another section for questions again, so thank you, but please let the questions keep coming. So we ended at this area, so was access service delayed? No, so now we move back up to the follow-up appointment. This is always a required question. So was a follow-up appointment required? I said everything's kind of just assessment occurred. We still want moving on with treatment. You say yes. The first follow-up appointment offer date, whatever that was, I'll just say it was on the 4th, on the 1st of May. Refer to out-of-network provider, no. It's always yes or no. If it's not applicable, select no. And if at this point, if this all happened as, it just worked out as it did, and there was no psychiatric services referral made, you could click submit and the form is done. Though I want to, of course, show what if there was no follow-up appointment or there was a referral closure. So I'll go through that a little bit. So for one example was that follow-up appointment, we assessed for whatever reason, there was no follow-up appointment. So we click no. What you'll see is once I click no, certain boxes will become activated while others will be grayed out. You'll see that this will become deactivated. And you'll see my answer that was there goes away. And you see now referral closure reason is activated. The referral closure reason probably has, I want to say that has the most logic built into it, which is great. Meaning that depending on what you select, different boxes will become activated and deactivated. Most of it has to do with the first service appointment, render date, and the follow-up appointment. So for example, if I said that the beneficiary did not accept any offered appointment dates, that's what happened. So I click, this is the referral closure reason. You'll see that since it says did not accept offer appointment dates, then of course, then the render date must have not happened. Because we offered and the beneficiary did not accept any. Now, beneficiary accepted offer appointment date, but did not attend initial appointment. Still the same thing, right? Actually did accept, but did not attend. Beneficiary attended initial appointment, but did not complete assessment process, which then means that there must have been at least one appointment that happened. And you still fill out the first render date, but the assessment did not complete. Beneficiary attended first service appointment, but declined treatment. Beneficiary did not meet medical necessity criteria. I want to note, as I'm going through all this, as I said before, this logic is explained in the PowerPoint guide that you will all receive. Out of county presumptive transfer, you see that they don't become required, but they are filled out as needed. Meaning that this could have happened any point of the service. So we're just going to give an option that any of this could have happened before out of county presumptive transfer occurred. Unable to contact. Then of course, everything always becomes grayed out, meaning that we weren't able to contact the client for whatever reason. And if there's the other specific. Once this is activated, or once you're also saying there's no follow-up appointment that occurred, then we'll have to say, well, what date was a closure date? And any additional comments you want to communicate to behavioral health. I am going to undo all of this for my example, but I just want to show you these steps. So it's a yes. So it's the first. That's and I want to pause right here. Are there any questions?
Cecily has a question.
I think you have to unmute still. Looks like she's still muted.
Yeah. I can only ask to unmute, so Cecily has to.
Oh, I see. Cecily, if you want to ask your question, you just have to unmute yourself now. There we go.
I have a question regarding like referral source. Do they have the choice, like if we receive the referral from call center, we just choose?
I'm so, I'm sorry, can you ask again? I heard something about referrals from the call center.
I got it.
Oh,
So
okay. Oh, go ahead.
When the referral source you're talking about is actually the point of access, Cecily, it's where the referral's coming from. So you would choose call center on point of access.
How about in the referral source, where what we need to put?
That is who's making, it's basically the person making the referral, like we're calling for the referral. In the example Chris sent out, it's a family member is the referral source and they're walking in with
But how do we know that it is from family member? Because we just received the referral for call center.
the IST would show you the referral source. The referral you're receiving from the call center should show the referral source.
I never see the referral short in the referral I got from call center.
I'm not
I
sure.
don't know where we can find it.
I'd have to see what referral you're receiving because the ones that I've been shown, it has it on there. But so we can meet offline and we can walk through it if we need to.
Okay, thank you.
Okay. And I want to share, we'll share at the end of the email too. We will share any questions that are not answered and you have follow questions. I'll just say it now. We will have for general questions, there will be a QI email address that you will pose your question to. And if there are technical My Avatar questions, then you would email EHR info, which I know probably some people, most CCPs would know about. But we'll share that. We share that now, but we'll also share that later. Any other questions? Okay. We'll then move on then to psychiatric. So what we're saying now is that there was a request for psychiatric services. So we say that we're providing services and it made sense that we want this individual beneficiary to see psychiatric services. So referral was made whenever this referral was made. So I'll say it was made on the 1st. They'll tell you a successful referral for psychiatry is a client completing the assessment process and continuing psychiatric services. Click OK. So first, psychiatric appointment offer date. For this, I'll just say that it was the 10th or today. And it was rendered today. Was access psychiatric appointment delayed? Psychiatric appointment delayed is defined as more than 15 business days, not counting weekends or holidays. So that's less than 15 days, business days. So I'll select no. If it was greater, then you will select yes. And once again, you have these choices that you have to choose from. Was it a treatment modality unavailable? Was it a preferred behavioral health provider unavailable? Was it a preferred service medium unavailable? No available provider or other. If other is selected, you specify other. For my example, I'm going to undo this. So click on other, click F5. No, because we know it's less than 10 days, 15 days for psychiatric services. Refer to out-network provider, yes or no. So select no. Closure reason just has to be completed. If there was a closure, if, as we said, went through the assessment process or missed appointment, it tells you right here, right? If where's the closure reason. Once again, this has the most event logic, which is also in the guide. So you just For example, beneficiary did not accept any offered appointment dates. Tells you what's required. Beneficiary accepted offer appointment date, but did not attend initial appointment. Attend initial appointment, but not complete assessment process. As always, it will activate what boxes needs to be completed for this closure reason. And so forth. Attended first psychiatric appointment, but declined treatment. Beneficiary did not meet medical necessity criteria. And you see that this does become a required field, referred out network provider, yes or no. Out of presumptive transfer. Fill out everything as needed. The only that is required is a closure date. Unable to contact. And other. For any of these closure reasons, we do need a closure date. And any comments you want to communicate with behavioral health. As I said, for this particular one, I'm going to do this, F5. This happened today. And that's the psychiatric section. Any questions? Right, at this point, then the form is completed. So next, what you would do is click submit. If a red field is not completed, I'll show example. And I try to click submit. You'll tell me it's red flagged, saying that a required field was not completed. So we'll go back. Fill this out. Click submit. And this is where I want to show that, see if you have a completed tool. I'm going back into it. So I make sure that I have my client selected. You'll see that it's gray. That's how you know it's selected. You also see that when I select, this populates too. So BHSD Timeliness tool. Go back to ACCI and mental health because that's where I submit that. You'll see now there's a line here. If I click on it, I'm allowed to edit. And I'm showing this edit because what I'm going to show you next is that we do have an error report for the timeliness tool that your agency should be running to ensure that this tool is being completed correctly. So I'm going to exit out of this, cancel. Your report number is 7599, which once again will be shared with you all. It's a CCP timeliness tool error. If you click on it, you just put the start date that you are looking at, time frame basically. So I mean, what I would, since we're starting on the 1st, the start date would be 6/1/2024 till whatever date you're running. If it's August 5th, if today was August 5th, I would run it from June 1st through August 5th. And then on the side, you select the provider. You hit process. Due to this, I'm not gonna, I do not want to show PA recording. What it will appear as after you extract the file to Excel is like this. We redacted information on it. You'll see that how you would read this report. Each column is a field in the form, and each row is one form being completed. So there's 3 forms total here. You go left, You see there's no error, but what you're looking for is where it says missing. So it means that the first service appointment render date is missing for some reason when there should be data here. So you can go back to the left and you can figure out all information of which form, which client this is, and then you can go back into the form as I showed just previously, click edit and make your correction. That is everything I have to show. Are there any questions?
Eva has a question.
Hi, so my first question is the idea of this that it's not being submitted like on a monthly basis, but that you're constantly kind of updating and filling this out? Because before at the TADT, it was like, hey, this is due by, for example, today for April, May 10th, the TADT is due. Now is this kind of like every week you should be filling this out and kind of keeping it updated?
I'll do that, Veronica.
And you should just be keeping it updated as possible, so that obviously, so it doesn't pile up on your end. And so we're still expecting that it gets entered in a timely manner. We do understand that the psychiatry portion, again, it could be happening at a later date and time, but it still gets in a timely manner from the initial request for psychiatric services. So,
Right. And I'm SUTS, so like the psychiatric services, that's not really applicable to me, right?
if it doesn't apply, then it wouldn't, it wouldn't.
Great. And then my last question, I'm just a little concerned. We have we're one of the bigger providers. I'm from Pathway House, so we are getting about maybe over 300 referrals a month. So that's either me going to be manually entering all this information for 300 people, or that would be trying to train people who are already stretched pretty thin. Is there any way to maybe be able to still submit like the spreadsheet and load it into this? Is there any sort of process that would be available for that? Because I've kind of automated this process on the back end for us. And I'm just worried about how much time this is going to take away from either things I'm doing or things our team is doing, just because we're kind of spread thin right now and we are still looking to hire a couple more people.
Yeah, at this time, there has not been any, it's been discussed, but there has not been any process set up to automate this and send it out.
Okay.
Through.
Cool. But is it maybe like, is there potential for that discussion? Because like, I understand this information is really important and we want to provide you this information, but it just kind of complicates, it adds a layer of complexity for my team.
I understand. Yeah, it was brought up, but there's not been any ongoing discussion. I'll mention it again. We do have a debrief that we have next week that we're going to talk about things that were brought up during the training, and I will bring it up again.
Okay, great. Thank you. I appreciate that. Thank you very much.
Okay, Kathleen.
Hi, everybody. So first, I just want to say I've been a part of the team that has been using this for a couple months, and you guys have done a great job. It's so intuitive, so happy about that. I just want to make sure that we're clear. We never see an IST number in our dropdown, and I just want to make sure that there's not some kind of link missing for us. Even though I know we have the IST from the call center, they're not showing up at all.
Kathleen, I will have that looked into.
Okay, thanks, Veronica.
You see, Chris was able to, so maybe it's something to do for.
Yeah, I was surprised when I saw in his drop down. I'm like, dang, maybe we're missing something. So, and I can send you an email if you like.
Thanks, Kathleen.
Okay.
So the other benefit of having the spreadsheet on my end is that I would do essentially a quarterly report for internal purposes. Are we gonna be able to run reports on essentially our timeliness access data? So if at the end of a quarter, can I go, well, we are scheduling first sessions within 7 days, or like something of that nature? Can we get reports like that?
Andrew, there'll be something I'll bring up next week at our debrief meeting, because we do, that was a discussion item that we had.
Okay.
All right, other questions? Is there another hand raised that?
There is, as we have to unmute
Uh,
yourself.
No. Hi, I have a question for psychiatric yeah. I just wonder if some clients they don't need the psychiatrist at this time, or they don't want to access to the psychiatric appointment right away. So the start date supposed to be the date that they request. It's not like after referral date, 15 days, correct?
Yes, it is, if you're asking for was access to psychiatric appointment delayed, it is 15 business days. That is
From the referral date, or from the date
the
the client request.
from the date of request for psychiatric services.
So from the date that the client requests. Okay,
Mhm.
that's great. And I just wonder, like, how do we know that we need to come into present it to fill out it? Like, when we supposed to do this soon after we receive the referral?
So can I ask, so which CCP do you work for? Cecily,
Yeah.
which CCP do you work for?
Patient admin provider connects. I mean that we need to go in this instead of go
No,
to
which
spreadsheet.
agency do you work for?
Oh, I agency it Mekong.
Oh, Mekong? Oh, okay.
Yeah.
So I would imagine it would be the process it would be the same. It's the process would be, instead of the CSI assessment, it would just be this form you're completing. Because you guys already have a process for how you guys complete the CSI assessment, correct?
Yes, but usually for the family asset, I did it in the spreadsheet.
Yes, and I think that's what Veronica brought up. There is gonna be no spreadsheet. So it'll be up to your agency to track that. Though what we are gonna bring back to the debrief is looking into a report in my avatar so that you all can run to make sure that this is all tracked. But for
Yeah,
now, it'll be up to your agency to track the referral information.
Okay. It's not a reminder from you that what date is due date for us to submit, to do it?
To complete,
Yeah,
so
to complete
complete
the
this,
timeline.
to complete this form, you mean?
Yeah, to complete the timeline tune, this one.
To complete this form, it's just you have to complete as each client comes in, and we're not here, we can't figure out, identify like what your workflow is or how you all, Mecon wants to do this, though you guys need a workflow to make sure that this is completed in a timely fashion.
Okay, so we just need to complete as soon as we can, right? But
I would,
no do that.
Yeah.
Okay.
I would say I was complete as neat as you guys can, as a timely fashion. And as you say, because we don't want to set up like this has to be done by this day and this date. You know, I don't think that's what we can say at the county. So it's up to you guys to have your workflow to figure out, make sure that this is completed in a timely fashion so that we can have this information when the state requests it. Now, if you want a more, we can definitely, another option is if you want to set up a time to just talk through this some more, we can definitely do that more in a one-on-one. At the end of this meeting, we'll also paste in the chat. There will be email addresses. So for general questions, you can definitely email QI for discussing workflows and such. And then for more technical things that have to do with the form or, you know, anything with, because PCE and PCNX is different than technical thing, then please email HR info. How's that sound?
Sound good, yeah.
Okay. Yeah, just send us an email and we can definitely meet and discuss.
Andrew has another.
Yep, thank you.
And I put it in the chat earlier, but so when you're filling out, so you said this form will it'll catch if there's missing information. But on the spreadsheet, there were times like say I misentered a date and like the logic doesn't make sense. Like I can't have provided a service before I've done the actual intake or done the assessment, you know, so those dates get screwed up. Does the system catch something like that as well?
Yes.
Okay.
Sorry, Chris. We did build some of that logic into the form itself so that it catches that some of more logical, that logic thinking that one thing can't happen before the other.
Okay, great.
Okay, any other questions? We appreciate all the questions that are asked. We know that we have some follow-up, which we'll bring back to the group as we debrief this next week. As noted, this meeting is recorded, meaning that we'll have this uploaded so that anyone such as you all that are attending want to watch it again, or for individuals that cannot make it, they can watch this video. Also, the PowerPoint guide will be shared with you all, but also this guide will also be uploaded onto our website, which you all have access to, where we have, you know, guides for how to do admissions, discharge, so forth, and everything else in between. So I want to thank you everyone for joining, and I hope everyone have a great rest of their day. All right. Bye, everyone.